Greetings from Indian Journal of Anaesthesia. I am Dr. Kiran Mahendru, and I'll be presenting today a review article published in the May issue of IJA. It is a scoping review of feedback features during clinical education for anesthesia trainees. External feedback is considered necessary for learners to achieve task competency, career progress, and professional growth. Feedback may affect learning outcomes and desired behaviors differently. The literature about feedback in medical education is unclear. Now, how it should be conducted and the effective approaches to provide or receive feedback is unclear in the present literature. There is a need to improve the assessment and provide meaningful feedback into competency-based medical education learning environments. In the operating rooms, the workflow is usually busy, distractions are common, and there is lack of privacy, which may affect the feedback conversations. Influence of these and others confounding factors on the feedback process is still unknown. For operating room anesthesia, written or verbal feedback is often provided face-to-face upon completion of a task or at the end of the day. In the UK, in its curriculum for anesthesia trainees, the Royal College of Anaesthetists suggests that high-quality, supportive, and constructive feedback is essential for professional development of anesthetists during their training period. It emphasizes that trainers should deliver effective, valuable feedback and encourage the integration of reflection. There is no evidence-based framework or model which describes how to achieve these objectives. In the USA, anesthesiology residents, they contribute to their professional progress through the annual Accreditation Council for Graduate Medical Education survey. However, the effective implementation of bidirectional communication and interpretation of feedback between anesthesia supervising faculty and residents is not straightforward. Therefore, this scoping review aims to map the feedback literature for clinical education and learning, specifically in anesthesia, and to evaluate whether a systematic review can be performed and its criteria. A corollary objective was to identify the potential knowledge gaps, which once addressed would facilitate understanding the generalizability of earlier research to anesthesia residency programs. The primary objective of the scoping review was to evaluate whether a systematic review can be performed for anesthesia residents' feedback features during clinical education and its criteria. The secondary objective was to provide an overview of evidence on feedback for clinical education in anesthesia. So for this scoping review, the authors followed the recent guidelines. The authors established before the search that they would evaluate what techniques, technologies, or tools, that is, interventions, were used in multiple articles more than equal to 5 to provide feedback to the trainees. Interest was interventions with more than equal to 5 articles because for sample size of fewer than 5 articles, random effect meta-analysis estimates of standard errors are inaccurate even with adjustments. The inclusion criteria was the studies published from 2014 to 2023 in a formal clinical environment, that is operating rooms. The study population included residents or trainees in anesthesiology or anesthesia postgraduate education, including physicians, nurse, anesthetists, or anesthesiology assistants. The focus of the literature was feedback interventions to clinical learning and training on practice and outcomes. And the feedback specific focus were how the feedback is provided, the receiving, the process, and the perception. The effects of feedback on individual learner was assessed, that is the motivation, knowledge acquisition, retention, satisfaction, communication, and professionalism, and feedback integration with other methods like audits and reflection. Studies outside this time period were excluded. Studies with other contexts like using simulated learning environment were excluded. The study population, the inferential results reported are from mixed focus groups like anesthesia residents mixed with residents of other specialties or faculty were excluded. And review articles, editorials, letters, book chapters, and conference papers were also excluded. The authors identified and listed all the dependent variables from the studies included for the analysis. They grouped and relisted dependent variables according to the feedback context and focus. To ensure that determining each article's dependent variable was replicable, authors created a folder with copy of each article and the dependent variables were highlighted. Coming to the results, the scoping review included total of 14 articles. There were 0 to 3 publications annually from 2014 through 2023. The publications were mainly 12 publications were from USA and 2 were from Canada. The trainees were all anesthesiology residents. Most publications were from university teaching hospitals. Of the 14 studies, 11 were mixed type, either retrospective, prospective, or randomized control trials involving wide-ranging sample sizes, while 2 were qualitative and 1 was a quantitative study. Now, this is the Prisma flowchart for the scoping review, where the articles were identified, the screening was done based on the eligibility criteria, and finally 14 articles were included for the review. Coming to the results, anesthesia residents' feedback-related publications were almost equally published in anesthesia. That is, 6 articles were published in anesthesia journals and 7 articles were published in medical education-related journals. The parameters of the included study span multiple categories, like individualized feedback from routine clinical performance metrics and their documentation, resident self-perspective about feedback in the primary operating room clinical setting, and formalized feedback tools or quality at the program level. Multiple technologies were used, including anesthesia information management systems, electronic portfolios, electronic health records, and machine learning for various purposes, including real-time automatic digital data, analysis of written comments, extraction of information related to practice habits, and prediction of feedback quality and utility was done. The data are insufficient for any meta-analysis because no dependent variable was observed in at least 5 studies. Now, this is the reported resident, faculty, technology, and technique-related feedback features for residents, clinical education in anesthesia among studies included in this scoping review. Now, the feedback for the residents included self-assessment and self-reflection, professional development, a timely individualized actionable approach, an objective approach, specific approach, and feedback quality and quantity were analyzed, feedback utility, feedback setting, faculty variability, the perception and satisfaction of the residents, relationship with the faculty, average peer comparison, and reducing the emotional burden. For the technology, evidence-based performance data was seen using electronic health records, e-portfolios, electronic quality databases, technology-based recordings, technology-based surveys, email communications, and machine learning. For the technique parts, there were valid instruments like DOPS, that is direct observation of the procedural skill, the feedback agreement between the faculty and the resident, use of LEAF model, that is the learner engaged analysis of feedback, some new initiatives, face-to-face feedback techniques, that is verbal feedback, written feedback, peer feedback, score to assess the quality, and multi-source questionnaires. For the faculty, timely specific feedback to provide feedback for quality metrics, practice habits, and non-technical skills using ACGMA milestone mapping. Now, bidirectional, asking for the feedback to be fair and honest, having a relationship with the resident, feedback retaliation, gender equality, specific to year of training and the education environment are some of the feedback features. Now, feedback context and examined dependent variables were also listed in the scoping review. The feedback focus or context were on the task or routine practice or performance, the resident self-assessment or perception and satisfaction, what was the feedback process, other ACGMA related endpoints, the resident, faculty, or others relationship, and the use of artificial intelligence. The authors found that methodologies used to investigate these themes were variable. with a range of procedural steps and instruments being used for involvement of residents to express and elaborate their self-assessment, perceptions, emotions, and satisfaction. They included pre-intervention and post-intervention web-based surveys, thematic face-to-face interviews, collaborative meetings with the faculty, and a multi-source feedback questionnaire. Systematic reviews could investigate themes about residents' perspective on feedback in the operating room settings. In this scoping review, authors have explored published literature on feedback involving anesthesia trainees during the clinical training. This was done to find evidence, identify what specific feedback categories can be utilized for a systematic review. All the residents in the analysis were from USA or Canada, and residents in these two countries are typically older than those in other countries because of the prerequisites required for a standard medical school in these countries. The authors did not encounter a single study from other countries regarding anesthesia trainee feedback, engagement, and effectiveness during their training, highlighting that there is a significant gap in the literature. The anesthesia training typically spans 3 to 8 years depending on the country, and in some of the countries, there is combined undergraduate and medical education. This scoping review revealed that any future systematic review would be useful for listing endpoints like PONB that can be provided automatically and in what context. Technology enhanced feedback has advantages such as the accessibility is everywhere. The results show that systematic review would be without meta-analysis because the results are the categories themselves, not a standardized mean or equivalent for an outcome. To the extent that a systematic review would be quite limited, then the authors argue that a scoping review itself has successfully provided realistic context to national efforts, guidelines, refresher sessions, and training on providing feedback to anesthesia trainees. The automated technologies offer a broad spectrum of functionality. These technologies can provide individualized, real-time, regular feedback on quality metrics and use algorithms to offer various feedback types. This adaptability can facilitate and improve the feedback process in anesthesia, catering to local institutional or program requirements. However, such advanced technologies may not be available in the limited resource countries. Therefore, the results of future systematic reviews may not provide insight into how the feedback is gathered and delivered during anesthesia residency in countries outside North America. The current review made significant strides in mapping the feedback literature. The need for future studies is also underscored by the need to include effective feedback strategies for residents working in multiple workplaces because residents rotate through various clinical sites during training. Excluded feedback studies conducted in simulated environments, which is a common teaching method for several clinical problems. And the authors also did not conduct a quality analysis of study as it was not a requirement for the scoping reviews. Knowing the results, consideration of study quality would not have changed the conclusion that a systematic review can be performed for categories of information provided by feedback automatically because each article reliably showed that they provided the information automatically. The author specifically reviewed the literature of the last decade with a focus on changes in competency-based anesthesia education in 2014. To conclude, the authors highlighted the variable features of feedback conversations between anesthesia trainees and other stakeholders, including faculty, program, and regulatory authority. The technical and technological approaches also enhance feedback processes involving anesthesia residents during clinical education. Based on the limited literature, there are limited opportunities to conduct a systematic review. The opportunity would be the categories of performance feedback provided automatically to residents in the anesthesia specialty. Thus, this conclusion underscores a lack of broad evidence on factors enhancing feedback effectiveness and reducing variability in giving feedback by faculty in clinical learning environments. Future studies should examine earlier studies' findings in different anesthesia departments, like outside North America. Thank you.